Welcome to KDH Counseling's Leaning into Therapy series, where we explore therapeutic approaches and evidence-based protocols to give clients the most comprehensive understanding of therapy. Our goal is to empower clients with research-based interventions so they can make informed choices about their treatment. Join KD Holmes, a licensed professional counselor with 16 years of experience, and her team of clinicians as they share their expertise, insights, and therapeutic interventions. Get ready to delve into the world of therapy in this series specifically designed for clients by therapists. So today it's me, KD Holmes, and Whitney Storey, and we're going to be talking about neurodiversity affirming therapy.
Yeah, our practice, I think as a whole, we could claim this, everybody, but definitely us. We are neurodiversity affirming clinicians. And one of the things you and I have talked about is I think when other clinicians hear that, if they have any idea what that means, it's probably still different than what they think, if that makes sense. Has that been your experience?
Yes. Yes. And it's really interesting to see how people take that. But okay, so give me an example of somebody misunderstanding it.
So I think because most of my work is with autistic clients, I think when I talk about neurodiversity affirming care, it's nice in that I think there are things that most clinicians do that are neurodiversity affirming, but they and their practice as a whole may not be neurodiversity affirming. So, for example, when I talk about I don't have any therapeutic goals with clients about improving eye contact. I don't care about eye contact because it's not an important thing as far as like living for myself and for most of the clients that come in. And I think more clinicians have jumped on that bandwagon where it's like now we're all kind of like in agreement that like maybe eye contact isn't that big of a deal. But neurodiversity affirming goes beyond just those things.
I love that. Well, and I think a lot of times people, when they think neurodiversity affirming, they're like, well, I don't work with autism.
Oh,
I don't work with ADHD. So this doesn't pertain to me because I don't work with these clients.
I'm a trauma clinician.
Correct. That's exactly. So, just for y'all to know, I am the trauma clinician, and that is exactly how I got down this rabbit hole, right? It's like so crazy. I think you cannot be, I'm not going to say it that, but I think in order to be a really good trauma clinician, you need to know this information just so you know how to navigate it with your clients.
Yeah, one of the things I think I hear the most from clients that when they come to me and we're talking about like what does therapy actually look like? Like how do we know? I usually ask my clients in the first session, like how are we going to know when you're done with therapy, when it's time to graduate? A lot of the things that maybe they had in mind, a lot of the things that their past clinicians had in mind are not the things that I would expect by the point that we're done with therapy. And I think especially for when I'm thinking about like trauma, a lot of my clients talk about like they've been in mental health, they've been in counseling like their whole life, and they're still in counseling and they haven't really found like the thing that has worked or has helped. And that to me is like, oh, we need some neurodiversity affirming care here. So I wonder, is that the same experience you've had with trauma?
Well, yeah, because I think that most people, when they're, my camera's freezing, but most people, when they come to therapy and they've had lots of therapy, they think that there will be an endpoint, that this is like, even the way they view their problem is treatable and changeable. Even the problem they're coming with is seen through the problem dynamic, like that kind of framework. And that to me is what neurodiversity affirming therapy blows up, right? Like even what we view as a problem may not be a problem, like eye contact.
100%.
Right. We don't, who cares about eye contact? Um,
So
unless the
with that
client,
with that being said, like how would you how would you or how do you define neurodiversity affirming therapy?
Hmm. Okay, you're probably going to be better for this first description, but okay, and because I am neurodivergent. So, in my own brain, the way that I define neurodiversity affirming therapy, it is a type of therapy that looks at problems that the client comes in with as possibly from their way their neurological brain works. And so, if it is the way their brain works, we cannot make it a goal to change it. We're wasting time and energy, and we're creating an irrational goal that will never be achieved. They will forever be in therapy thinking that they are the problem. So, but that doesn't mean that if a client comes in and it's neurological, that we don't address it if it is a problem. So it's super flexible. It's flexible. If they think
Yeah.
it's a problem and they want to change it, I'm on board if it's possible to change.
And I think that's an interesting and a difficult part, probably for clinicians and also definitely for clients, where it's like, I know a lot of my clients come in and one of the first things I have to tell them is like, what if that will never go away? Like, what if this is just how it is? And in ACT, this is, I think, one of the reasons why I think ACT has worked so well for me as like a human being and also as a clinician, is kind of like the first stage of therapy in ACT is we're getting to a point of what ACT calls creative hopelessness. And so it's like there's the sadness, like the hopeless part of it, but then there's like this whole creative part of it. If we're not spending all of our time trying to make your brain be a not autistic, not ADHD brain, then we have so much time to do so many other things. And that's like the creative piece of it, which is really cool.
I like that. They have something similar in DBT. It's like radical acceptance.
Mm-hmm.
And I love, like, if we were to just accept that this is who you are and this is unchangeable. And look, maybe it is, maybe it's not. I don't know. But right now, it's unchangeable.
Mm-hmm.
What would we be focused on?
Mm-hmm.
And that's a really condensed, simple version of that. But it's similar. And I think that flexibility is really the important key or the important ingredient because it's meeting your client where they're at. And for me, it's I'm trying to it's like untangling and getting rid of the narrative that they have carried their whole life, that they are the problem, that they are wrong. It's changing that. And that traditional forms of therapy, that's what it does. It's like you're in a trauma response. Um, we need to get you to get to feel safe in this room. Well, what if you just can't? I mean, there are certain things I think we do because we're well-meaning as therapists, right? We
Of
don't mean
course.
to be harmful, but maybe it's just it's perpetuating that they're the problem. There's a word for that. It's further pathologizing them.
Yeah. Yep. Yeah. I mean, I totally agreed with your like definition or explanation of neurodiversity affirming therapy. And I think the pathologizing depathologizing is a big important piece of it. Yeah, and I think it fits, that piece of it also fits into so much of what's important to me as a clinician too, around all these other like levels of influence, levels of control, like when the client starts to see their brain as, maybe my brain is not the problem, maybe the problem is that the world is not set up for people like me. um it can be really empowering. It can also be sad, like that's why I think I like that creative hopelessness
Mhm.
exam or term or whatever to explain it. But yeah, it's very interesting. I have like some examples maybe of clients who come in and what they're thinking, what they're asking for maybe isn't what we end up paying attention to, working on. So I have clients come in and they are telling me their goal, how they know they'll be done with therapy is when they can be in the world, like go with their family to Costco and do shopping. They want to work full time. They want to go back to school. They want to finish school. They want to like do all these things that are very like normal to want. And what if there's more to life than going to Costco and doing shopping, which
So,
is fun.
well, and I love this because I do think people come with these goals. You know what I mean? And it's not realistic. And I know why it's not a realistic goal, but let's talk about it here. So they would come and say, let's just take the example, go to Costco with family. What's wrong with me that I can't do it? And by can't, I would be like, so what's going on?
Yeah, tell me more.
Yeah, trauma therapists would be like, oh, dissociation. Oh, there must be something related trauma-wise as to why, when you're in groups of people, you're having this dissociative sort of experience where you shut down and you're not even present to socialize, right? With your family, you can't even enjoy it. You get home and you are worn out, shut down.
Hmm.
What else would you add to this? They might have social anxiety that they describe.
Oh yeah, I'm sure they would.
Hmm.
And so thinking of, this combination of clients I've had in the past. So of course, not talking about any one of my clients in particular, but like this idea of a neurodivergent client in that setting, lots of like internalized shame, maybe even like well-meaning, very sweet family members who are like, we do not get this. We do not understand it. Something is wrong. And then I'm thinking of, especially a like very traditional trauma therapist, like going right into like the trauma work and trying to figure out like what is this trauma that happened so that we can tease it apart or like do the thing to try and like fix that little bit of trauma so that then they can be normal and go to Costco.
Okay, so let's do the neurodiversity affirming approach. What would you do with this client? Like, I guess theory wise, how would you look at this with that lens of neurodiversity affirming?
So I mean, one thing that I always end up asking is like, well, yeah, going to Costco sucks. What is so like, tell me more. Like, why do you want to be at Costco? And exploring what we eventually get to, like some values work. And it's really more about like being, for example, maybe like being with family, like doing this thing that we always do on Saturday, like once a month, my family does a Costco trip. I just really want to be involved in this like family thing. So that's one direction we might go. And then that changes kind of how we work with Costco. The other direction that might happen is like, oh, I've never really thought about it. And then they sometimes there's like not even words around why they want to go. It's just like this thing that for whatever reason their brain has become attached to, or it's like, well, I've got to be able to do this. And then when we start teasing it apart, it's like, oh, actually, I don't need to go to Costco, and that's fine.
Well, and then I'd be like, and what else do you not want to go to that you're making yourself go to? But
Sure, yeah.
so I break it apart. So it's like the different ways we work. So I break it apart with their sensory differences. I'm like,
Yeah.
what? Do you have any sensory differences? And most of the time they're like, I don't know what you're talking about. I'm like, have you ever done one of those tests? So I give them like a little test and we go
Mhm.
through it. Often there's sound differences. And what I mean by that is they have a sensitivity to sound, or maybe, okay, it might be that. It might be like a visual sensitivity. There might be like problems, with all their
Yes. The
sensory.
lights, the
Yes,
people, the sound,
yes.
the smells,
The
the
movement.
driving.
It can also be, I've been really thinking of individuals pacing in their brain. So sometimes in ADHD, we process information differently. And these environments, it's too much.
Yeah.
And so people can feel really overwhelmed by the too muchness of it because of the way their brain processes information. And so, yeah, so if it's that, you're not going to be able to do Costco. You just won't. Not with any sort of like ease. Like, and that
Not
is,
not raw.
yeah.
Um, yeah, and so this is interesting because this is like the exact same thing that I do. That's kind of like step two, where it's like, okay, if going to Costco is like this big tradition in the family and you want to be a part of the family, here's what we know about Costco and the environment. Let's talk about the sensory stuff. And I think what you lead into next too is like, okay, now let's create some accommodations.
Mhm.
So if you really want to be there, and that's what's important, how can we like remove maybe some of the information that is coming into your brain and overwhelming it? How can we dampen? How can we prepare through the whole week to have the energy that we need and the spoons that we need in order to do Costco? How can we set up a schedule so that after Costco, you can take the time to do the things you need to do to recover from Costco? Like, there's so many different ways that we can go about doing Costco.
I love this. Like, this
Mhm.
is my most favorite thing. Therapists come to me unaware of this type of, I guess, theory that you can use to understand your clients. That's super powerful, right? Because if they don't understand it's sensory based, then they're going to go in and they're going to do their breathing, and like, oh, I'm okay, I'm safe. They're going to do all the things we do as therapists and they're going to try to relax their body, but they're still going to be bombarded by the sensory information and their brain is not going to have, it's going to be too much. And so what we're doing traditionally in therapy is not going to work.
Yeah.
And so I think, and some of the old theories in therapy, then we blame the client. Like, are they doing their homework? Are they actually practicing the skills? Some
Yeah, I can see myself like back in the day, maybe like spitting in some client's soup and being like, well, it sounds like you are forcing yourself to go to Costco and it's just gonna suck. How terrible for you. And like that's not what they need either.
I know. Well, and it's the way we attune to them because even in willfulness, even if they were willful and like, I am not going to do this stuff, I want to know why.
Yeah.
What is so threatening about Costco? And this is where, if you're like really, understanding your client and getting in there with them, you're going to find out some really, really affirming stuff in terms of like, it feels threatening. I don't like the way people are. And there are themes. So whether it's autism, ADHD, that identity piece, so many of them have the messaging like there's something wrong with me. And being able to like empower my clients that it's not, you're just made differently.
Mm-hmm.
And you were born this way and you were going to die this way. And I don't mean it mean, but it's like this
No.
just acceptance of self on such
Yeah.
a,
And it ends up being sometimes I think overwhelming too. I mean, for me as a clinician, as for me as like a neurodivergent person, for clients, because once you start really teasing that kind of stuff apart, where it's like, oh, actually there is nothing wrong with me. Actually, Costco kind of sucks in a lot of different ways. But then you start seeing all of the ways where like this world that we've built is it doesn't work for so many people.
Mhm.
Like, first of all, there's many of us out there who like it's not just you client, like it's also me, it's also like all these other people, which is really nice. But then also like what the heck are we even doing? Why is the world this way? And that can be really depressing. um which then there's like these layers to it too, where it's like, okay, let's like explore some of that depression. Like, no wonder you're depressed. Like, the whole world is not built for you. And how can we build your world to be more for you?
But I love the honesty in it, the authenticity.
Mm-hmm.
Um, DBT, that radical acceptance piece, like it is sad. There's going to be a lot of pain behind this when you are honest with yourself about your differences and you accept them. But
Mm-hmm.
once that happens, then you can find things that actually work for you instead of trying to be something that you can't be. Therapy has become a place where people think they can change everything with trauma work.
Mm-hmm.
I have done a lot of trauma work and I am still hyperactive, people, and inattentive. I almost think my inattentiveness is worse now because I'm not vigilant anymore. And so with that, and this is just an example, but it's like to get people to understand that some of this, we're just going to always be this way. Yeah.
Yeah.
Acceptance of self. I don't even remember where I was going. See, I got distracted.
Well, I mean, one of the metaphors that I give to clients that I think is helpful as I talk about, I mean, it relates directly to autistic people for sure, but not just autistic people. Like, it's what you just talked about too, this idea that like we speak a different language.
Mhm.
Like, at this point in my life, I could learn another language, it would be incredibly difficult. I would have to spend so much time and energy in order to do it. I might get to a point of fluency if I really devoted all that time and energy to it, but I would never probably get to the point where like I could be creative with another language. Like it wouldn't be like that innate creative, artistic piece of language. Like it would just be what was necessary. And I think that's such a good example. Like if you want to devote all this time and energy to like learning a whole new language, then we can give it a shot. But what I've found, I mean, definitely for me, and for most of my clients, like we get to a point where it's like, oh, actually, that's not the best use of all of my time. Like that's fine. I have this language, and this one can work.
Well, and I think that that describes the burnout part, right?
Oh
That's
yeah.
common. Like, yes, you can learn some things, but if it's not your authentic natural self, I mean, it's gonna burn you out. You will be
Hmm.
exhausted from the process. It's gonna take more energy. And really, is that what we're spending our time in therapy trying to do? Because a lot of therapy is about authenticity.
Well, and it wouldn't even, in order to do that, like it couldn't even happen in therapy. Like it would have to be like you wouldn't be able to work. You wouldn't be able to like care for children. Like the amount of time and energy that it would take to become fluent in another language starting now.
I
I
know.
Who can do that?
Well, and I think lots of clients come in and they're depressed.
Hmm.
And they're really good at masking because that's what we're talking about, right? Masking. They're really good at masking. They don't even know they're masking. They think it's like an authentic self sort of thing, but it's requiring so much energy that in order to treat the depression, you have to get through the masking and where all their energy is going because that's why they're so depressed. Yeah.
Hmm.
This stuff to me, and look, I just think it really changes the way we work with clients and the way we even frame what we're working with.
Yeah.
Ah, any other thoughts?
I mean, of course, but for another video.
I know. I know. I know. Look, I think a lot of what we try to give people is just looking at this in a different way.
Yeah.
Um, Lately, I think most therapists, we learn something and we become super inflexible in what we learn. Like that's it. It's like the end all be all. This theory and that flexibility, I don't know. I think it's essential for good therapy. You have to be open to meeting them.
Hmm.
What if we got it wrong? What if all these years we were missing this thing?
Yeah.
Do you think it's half of mental health? All of it.
I don't see, oh, and this just might be because I'm neurodivergent. Like I don't see how it can be separated.
Agreed. Well, I know because it's basically the whole way we view it or look
Mhm.
at the problem, right? Because it's not a problem if it's your neurotype. It's just who
Yeah.
you are.
Yep.
So, yeah, I love this stuff. We will have more videos where we discuss.
Good chat today.
Yes, very good. So today it's me, Katie Holmes, and Whitney Storey, and we are going to be talking about neurodiversity affirming therapy.
Yeah, our practice, I think as a whole we could claim this, everybody, but definitely